No, can we make this go away?
No, I can't do that. But
go over healthcare in Guatemala. His gentleman is from Guatemala. He is med school at USAC before coming and training as an ER doc here at Sept Hospital. And he loved it so much that he has stayed on. However, for the last 3 years now, he's been heavily involved in working on EM development in Guatemala. There's no formal EM residency training program or a formal society or anything along those lines until the work that's been over the last 3 years. We're happy to say that there is a new EM society, and the new EM residency has just been approved due to all the hard work of the last 3 years. So Dr. Ridelman has a fantastic understanding of the healthcare system and medical school education in Guatemala and all its work. He's here to tell us a little bit about it today. So a round of applause.
Thank you. Thanks. So my pleasure to be here. Like Chris said, I grew up in Guatemala, so mostly through my family, but I have experience as patient or family member in the healthcare system. Later on, as a medical student, for a short, very scary period of time in my life, I also practiced as an ER doctor. Right after graduating med school, I was still a general practitioner. I don't recommend you doing that. And now I'm working with policymakers and with education entities into developing emergency medicine. I am an emergency medicine physician by trade. And as of this year, the Deputy Ambassador of the American College of Emergency Physicians in Guatemala. There you go. This is Antigua, Guatemala. It's the previous capital. That's water volcano in the background. The city was destroyed by an earthquake hundreds of years ago, and it's remained the same style. It's a very touristy attraction. If any of you have been to Guatemala, more than likely you've been to Antigua. It's about half an hour from the new Guatemala city. So let's talk a little bit about just basic indicators about the country so you know a little bit of why the healthcare is the way we'll describe it. So 17 million people, 42,000 square miles, capital is Guatemala City. The city itself has about 3 million people, and then there's 2 or 3 more that live in the surrounding areas. The GDP per capita is pretty low, just under $3,500 per person per year. And then a big challenge for the country is that, in contrast to other Latin American countries, Guatemala has preserved their Mayan Native American population. So that provides a lot of cultural wealth to the country, but it makes any policy very challenging. Not only because of racism and discrimination that have always been present in Guatemala, but also because there are 23 different languages. So a big part of the population don't speak Spanish, which is the official language. It's a very poor country. 60% of the people live in poverty. It's the 13th worst in the world, and 13% of the population live in extreme poverty. 49% in rural areas, which also makes for a big challenge in healthcare as to access. The literacy rate is only 79%, and it's been improving lately, but it's a pretty dismal number. And then the Gini coefficient is used to evaluate economic inequality in a country. Guatemala has a coefficient of 55, so it's the 11th worst in the country. So you see some indicators like one of the highest helicopters per capita or BMWs per capita in the world, and at the same time 60% poverty rate. And then another factor that plays into healthcare is a very long civil war that occurred from the 60s to 1996, in which basically communist guerrillas were fighting the established government, private industries backed by the US and the CIA. About 200,000 people were directly died during the war, and it still has a huge impact in all of these. This is the fire volcano. This is a beautiful shot. This shot is from about 3 years ago, and it was published in National Geographic. So as to health indicators, it's important to note that Guatemala, into its constitution, it has healthcare as a right. So the government does have a mandate to provide healthcare to the country. That's in theory. In reality, Guatemala has terrible healthcare systems, and that is reflected in a lot of indicators. So to start, Guatemala only invests 2.6% of the GDP. If you remember Dr. Snell's graph, most developed countries invest 8 to 9, the US 17 to 18%. Guatemala, out of a very small GDP, only invests 2.6% of that into healthcare. So the average for Latin America is $672 per person per year. In Guatemala, it's only $196. That's it. Out of which 1/3 is from the public government. So the government invests $49 per person per year in healthcare. 65% of this is private. We'll go over it a little bit more. Life expectancy is 72 years for people that are born now, so that's about 101st place in the world. Infant mortality is terrible. Sanitation, which means clean water and sewage, is terrible. Obesity is starting to go up, as well as fast food and junk food, and Coca-Cola is becoming more available. Malnutrition is also terrible. Imagine this, almost half of kids under 5 years old are malnourished. It's really sad. Maternal mortality is also really bad, 113 per 100,000 live births. The doctor ratio is one of the worst in the world, 0.9 doctors per every 1,000 people. And this is in spite of Guatemala having a public medical school that provides free medical education for anyone that wants it. I went to the public school in Guatemala, so thousands of people sign up, and then during that first year, either they flunk the courses or they drop out. So in spite of this, there's a massive, massive shortage of doctors and nurses. Hospital beds is also one of the worst in the world. Only 0.6 hospitals per every 1,000 people. Causes of death are very similar to other undeveloped countries, with infections and trauma. And this not only affects mortality, but also the quality of life years. This is Tikal. Tikal was the Mayan capital. We're still not sure why, but the Mayan people disappeared. So now they use the term Mayan to group all of the Native American tribes and people in Guatemala, but really the Mayan civilization pretty much disappeared. They're not sure why, natural disasters or famine or disease or war. Their capital, Tikal, is in North Guatemala, and it was abandoned about 1,500 years ago and disappeared and forgotten. And then they found out that some of the mounds were not really mounds, but they were actually pyramids under a lot of dirt and trees and green. So they started excavating and they found these temples. Beautiful place to go to. Okay, so let's start talking about healthcare systems. So Guatemala, like the US, has a little bit of everything. So the government, through the Ministry of Health, or Ministerio de Salud Pública, does have hospitals and clinics, and they employ doctors and nurses, and everything is free. Now, on the other side, you have private healthcare system. There's no restrictions as to the government that says that there can't be private hospitals. So there are private hospitals, from very expensive and similar to what you find in the US to cheaper and more available and convenient, and there's everything in between. In the middle, there is the Guatemalan Institute of Social Security. This is a worker-based healthcare system. So we'll go through these. This is the pediatric ER in the San Juan Hospital. That's the largest hospital in Guatemala City. Tertiary entity that takes patients from all over the country. So these are the people that are staffing this is the main pediatric ER in Guatemala. And there was not a single attending there at the time we took that picture in the middle of the morning. Okay, so this is the healthcare system. So public and needs are grouped together as a public expenditure. Their budget is about $1.3 billion, and they treat about 53% of the population. So let's start with Ministry of Health. Their budget is pretty low for the amount of people that they're supposed to see. $650 million. And why is only 35%? It's